One of the questions patients ask me a lot is whether or not they should use heat or ice on an injury or a surgical site. A good rule of thumb is 3 to 4 days of ice after an injury or after an operation will help to decrease inflammation and swelling. On more chronic problems or things that involve muscle strains particularly, I think sometimes heat is a little bit better, especially a chronic muscle problem such as a lumbar strain, a pulled muscle in your back. But what I use probably more often than anything is a combination of heat and ice. Particularly after you get past the 4 days of injury or past 4 days after surgery, using heat before your exercises and ice afterwards I think is very helpful. So if Mandy has had an operation on this knee, which she did a long time ago, and she were going to do an exercise program, I would have her warm that knee up with a heating pad, a hot water bottle. A thermocare patch is a good way to warm up, particularly if you're going to be in the car before you can go to a ball game or something. Put a thermocare patch on there. That'll warm the site up really well. Then do your exercises. If you're doing a sport activity, do the sport activity after you've stretched, and then ice down the knee afterwards. So a good combination, particularly when you're at a phase in your rehabilitation where you're starting to do exercises for stretching and strengthening, and you're starting to get back into sports. Heat for 10 to 15 minutes, stretch, do your activity, and then ice down afterwards.